Good morning, everyone, and welcome. It's so glad that I'm so glad that you're joining us this morning. If you came on a few minutes early, you got to hear that wonderful instrumental version of Journey. Maybe it's an appropriate song, "Don't Stop Believing." We all are not stopping believing in getting through this period of time. And we want to thank you for joining us and taking time out of your day to focus on increasing vaccination rates in the workplace. We know that everyone has opinions and questions surrounding the vaccines, but we also know getting vaccinated is the best way to stop the spread of the Delta variant. The CDC tells us that, our region's chief medical officers tell us that, and so do medical experts around the globe. With the FDA approving the Pfizer vaccine last week, this hopefully has removed some hesitancy for many people. As business owners and employers, we all want to keep our workforce healthy and keep our doors open, especially our small business owners. Vaccines will help us do that. Here at the Chamber, we are proud to say that our workforce is 94% vaccinated against COVID-19. Today, we hope to provide you with the resources to increase vaccination rates in your workplace, answer legal questions you might have, and perhaps most importantly, you'll hear from your peers, fellow Chamber members with large and small workforces. Some have employees who are public facing and others have remote workforce. Some are requiring employee vaccinations and others are encouraging them, but all have a valuable and insightful perspective and experience to share with you today. We'll hear from those panelists in just a few minutes when we join today's moderator, Vice President of Community Engagement at CBIZ and the chair of our KC Chamber Board, Carolyn Watley. But before we begin, I'd like to share with you what we've learned from our members about their approach to vaccinations. The KC Chamber issued a survey about a week and a half ago to our member businesses to learn more about their thoughts and actions around the surge of the Delta variant of COVID. The survey closed on Friday, August 27th, and we had 184 responses, really from a range of sizes of organizations, from small to medium and large. And as you can see from the data on this first slide, the question on everyone's mind is if vaccines will be required in the workplace or not. The survey results show us that 85% so far have decided that they're not going to be requiring vaccination. We asked an open-ended follow-up question here to find out why businesses have or have not decided to go this route of requiring vaccines, and the responses range. So to give you a sense of it, we had some that already had a high vaccination rate with their workforce. Others had fear about company culture and employee morale issues. Some were afraid that they might have a mass exodus of employees in a time where there already is a stretched thin workforce. Some said they feared legal challenges, and others insisted that it's a matter of personal choice and there were concerns about how to enforce. Some respondents did say that they have not yet made their decision on whether to require vaccinations, that they're still working through that process. On the next slide that we've got up here, I'll tell you some of the open-ended responses we received about how companies are incentivizing vaccine. Some are offering cash incentives, and we heard from some that the ranges were from $50 to $2,500. Extra vacation days are popular, as well as paid time off for the time to get the shot and any recovery that's needed. Raffle drawings are popular too, items like parking passes and gift cards and sports tickets. One said their health insurance provider was also providing incentives for those that got vaccinated. And on this side over there on the left, you'll see the number 7. Our first question on the survey was to ask about the level of concern about the Delta variant, ranging from 1 being not at all concerned to 10 being of the highest level of concern. And you can see here that there's some concern. It landed at about 7 was the average of all responses. The next slide has a lot of data on it, but one of the things that we found interesting at the Chamber, and maybe a little surprising, is about the range of what's going on in approach about when folks are fully returning to the workplace. So if you notice on this slide, 29% of employers have not decided when they will fully return to the workplace. And down there at the bottom, you'll see 9% have already decided that they're not coming back at all in 2021. And that compares with a large darker blue part of the pie chart, where 48% of nearly half of workers are already fully back in their workplace. So the range of approach here is still quite broad relative to fully returning to the workplace. Then on our final slide, we asked respondents how they personally felt about attending virtual and in-person events. And I know we're all sort of getting exhausted with the virtual events that have become so necessary during this COVID time. But you can see here that 34% either prefer in-person events or a mix of events with more in-person, so leaning towards the in-person preference. And then the rest, about 66%, are more inclined to be virtual or mostly virtual in the event side of things. So some really interesting findings, and we want to thank all the businesses that were willing to take this survey to help give us all a sense of what's going out there within the business community and the Delta variant. And now I'd like to welcome today's moderator, my esteemed colleague and our KC Chamber Board Chair, Carolyn Watley. Carolyn, good morning.
Good morning, and thank you, Joe. As that was very interesting information, and as somebody who specializes in employee benefits consulting, and of course our firm also consults on corporate HR and financial services, I can speak from experience that workplaces across the country are navigating this pandemic unlike anything we've ever navigated before. And that includes how companies are handling vaccinations. And we know that so many of you have questions and special circumstances to consider. So we brought together a team to address some of those questions and considerations and to share our own experiences of the day-to-day issues that pop up. So you'll have a chance to ask your questions at the end of the panel. And so if you hear something that piques your interest, you can submit it during the chat in the Q&A portion in the chat. And now it is my pleasure to welcome our first guest today to discuss the legal considerations surrounding vaccines. And I'm very happy that they're with us today. We have Brittany Barrientos, who is a partner at Stinson LLP. She has significant experience in helping clients with environmental health and safety regulations under Osha, among others. She's also counseled clients on workplace safety issues in the fast-changing environment surrounding the COVID-19 pandemic. Also with us is a partner at Stinson, Molly Keppler, and Molly also focuses on representing and advising employers, many of whom are in the healthcare industry. So I'm sure that's been very interesting. Her practices and industries include labor, employment, and benefits, business litigation, employment litigation, and the coronavirus task force. So welcome, Molly and Brittany. And I'll turn it over to you, Brittany.
Thank you, Carolyn, and thank you everyone so much for having us to discuss this really important but also super complicated issue. Like Carolyn said, Molly and I have both served on our firm's COVID task force, so we've advised hundreds of clients across the metro area and nationwide and understand a lot of the issues that you're seeing. So next slide. At the outset, we're going to provide an overview of the legal framework and some of the common issues. This isn't necessarily comprehensive. We know from navigating the last 18 months that issues are facility specific, workplace specific, and new things can happen, but we're going to try to give you the legal framework of some of the items that we've seen come up kind of over and over again. And then the panel is really going to delve into what they've seen in their workplaces. So before we kind of take that step forward, I want to take one step back and start this discussion talking about OSHA's framework, as OSHA is the regulatory entity tasked with workplace safety. And we're talking about federal OSHA because both Kansas and Missouri follow federal OSHA standards. And OSHA has issued a variety of guidance documents over the last 18 months to assist employers with workplace safety during the pandemic. I'm sure that you're all painfully familiar with them, as are we. That said, the agency has struggled to revise its guidance as quickly as the CDC has, which has created significant logistics for employers to keep up with and to keep employees informed and invested in and not feel like things are constantly changing. Since we're talking about the vaccine, with the vaccine specifically, since the vaccine became widely available, OSHA has completed 3 key revisions of its guidance. And its guidance now focuses on protecting unvaccinated and at-risk workers. And so implicit in that is knowing and understanding whether your workforce is vaccinated. So if that's not something that you've done yet, that's something that you really should be working on implementing ASAP so that you can really get a handle on what's going on in your specific workplace. OSHA most recently updated its guidance earlier this month, and it added its most pointed statement to date about vaccine mandates, and now specifically and explicitly suggests that employers consider adopting policies requiring vaccination. So per OSHA's instruction, we're here today to help you think through and consider adopting these vaccination policies. From an OSHA perspective, unless you are a healthcare workplace, this is a guidance document. For healthcare personnel, I'm sure that you're aware of the emergency temporary standard, but keep in mind that that is separate from the items that we're talking about in the framework that we're talking about right now. And while this is a guidance document, OSHA has had a heavy enforcement initiative, and failing to comply with OSHA regulations can subject workplaces to civil penalties or citations. And OSHA can show up anywhere. They can show up randomly. They can show up because of a complaint or a whistleblower, because of the sector that you're in, because of your workplace injury or illness numbers. So keep this in mind as one of the overarching reasons that we're talking about this. OSHA has specifically tasked us as employers with looking at the viability of workplace vaccination mandates in your workplace. And so with that, Molly is going to get us started and get into the weeds on this topic and some of the common questions that we've been experiencing.
Thanks, Brittany. Let's go to the next slide, please. So I get asked about the same two questions almost daily, multiple times a day right now. And the first one is, can I ask my employees if they're vaccinated? And yes, you absolutely can. Not only can you, but as Brittany kind of alluded to, you should be doing that because it's important to know who is vaccinated, in part for quarantine purposes. If someone is exposed or test positive, CDC has different quarantine requirements depending on if they're vaccinated or not. So it's a good idea to know that for that purpose. People are doing this through oftentimes workplace surveys, just if you like monkey survey, or if you have an HR system where you can go in and self-disclose and are asking people, are you vaccinated? If not, are you fully vaccinated? Are you partially vaccinated? If not, do you plan to be vaccinated? And if so, when? So they have an idea of who is and who is not, and when they will be if they're not. The next thing we're seeing coming up now with the booster shots is companies are going to need to kind of update their survey and find out, okay, have you received the booster? Because that's going to be required to maintain full vaccination status. This information should be kept confidential. You don't want to be sharing it with people. You want to make sure you're not doing anything that might unintentionally disclose this information. For instance, we've had clients ask, can you wear wear a pin that says I'm vaccinated or I'm not vaccinated, so that people know when they're talking with each other? And no, you can't do that. You can have kind of ambiguous policies that say, if you're unvaccinated, we encourage you to wear a mask, but you can't do anything that would implicitly identify specifically if people are vaccinated or not. And you can ask to see vaccination cards for purposes of identifying and confirming that people are vaccinated when they say they are. So next slide, please. The next question I'm often asked is it legally permissible to mandate vaccination? And this is a huge one because a lot more companies are coming out and doing it. And again, the answer is yes, you can. EEOC has specifically discussed this and has specifically said that the COVID-19 vaccination it's not a medical examination, which is protected under the ADA, and which is not, employers are not allowed to conduct medical examinations except in certain circumstances. But here EEOC has said it's not. So you can require vaccinations as long as you are making accommodations for anyone who has a qualified disability under the ADA or a sincerely held religious belief, and the accommodation won't pose an undue hardship. So go on the next slide and we can talk a little bit more about that, please. So under the ADA, if someone comes to you and says they've got, they have some sort of medical condition, they need an accommodation or an exception from the mandatory vaccine policy, but it's not obvious, you can ask for physician certification. In many instances, you might know that it is, it may be something obvious. You don't need to get physician certification in that instance. But if you're not sure, you absolutely can get verification. Again, this is information that should be kept confidential as much as possible, but it's permissible. Within a religious belief, typically in courts would counsel, or court decisions have said that you should not make your own judgments about whether a religious belief is valid or not. There are the normal recognized types of religion: Christianity, Buddhism, Islam, Judaism, but there may be religious beliefs that are sincerely held that aren't typically aren't traditional beliefs. You should not make your own assumptions or judgments about that. That said, if you have reason to believe that maybe it's not a sincerely held belief, and the sincerely held is what's key there, then you can ask for additional information from the employee. One instance where I think this is going to come up often in the healthcare context specifically, since they're usually the employers who would mandate the annual flu vaccine, is if someone has taken the flu vaccine every year and they've been a 10-year employee and they've never objected to it, and all of a sudden now they're saying, well, I can't take vaccines, it's against my religious belief. There you might have good reason for saying, okay, this seems questionable, it's not in line with what you've done before, so let's get a little bit more information, and you can ask them to provide some documentation to substantiate their concerns. And then the other thing to keep in mind here is the religious objection is a much lower burden for meeting the undue hardship. It only has to be a de minimis cost, it has to be more than a de minimis cost to the employer. So if what they're asking for a religious accommodation would be anything more than de minimis, it's an undue hardship. It doesn't have to be provided. Next slide, please. So what can you do for reasonable accommodations if you do mandate a vaccine policy? Typically what we're seeing is for anyone who needs an accommodation, it would be wearing a mask, which generally speaking is something that everyone should be doing right now anyway, regardless of vaccination status. But when that changes, unvaccinated would keep wearing masks. Weekly or biweekly COVID testing. Remote work is also an accommodation if, for workplaces where that's possible, or changing a schedule to reduce exposure. The key here on when you engage in that interactive process and try to determine what is a reasonable accommodation is it does not have to be the employee's preferred accommodation. So for instance, we've had an example where, this is not necessarily COVID related, but just to demonstrate for you, an employee doesn't want to drive because they have dizzy spells, but they can otherwise do their job. So they've asked for permanent remote work. But in that case, we said, okay, well, you can take a bus or you can take a taxi. We'll provide that cost for you. You can still come in and do your job. So they gave an accommodation. It just wasn't the employee's preferred accommodation, and that's acceptable. Next slide. And I think it's back to you, Brittany.
Yeah, thank you. So those are the confines of, what are you looking at from an accommodation perspective when you're trying to mandate a vaccine? Let's talk about the logistics for a second, because that can be a big part of the battle. Molly said this like 3 times, but I'm going to say it again because it's really important. But vaccination status and information needs to be treated confidentially per the ADA. That means you need to have it treated by appropriate people and held confidentially. That is an important part that's easy to miss because it's something that's so public right now and that people are so public about. As an employer, your obligation to hold information confidentially does not change here. When talking about the form, literally form over substance, what are you supposed to be getting? Employers have used attestations where they say, and you have to sign a very brief statement explaining that you've gotten the vaccination. That's a form that you can get and someone can provide to make sure that you're just getting the appropriate information and that it's standardized across your workplace. You can have someone within your workplace view the vaccine card and make a record, has a vaccine, doesn't have a vaccine, and keep a simple spreadsheet of it with necessary information. Or you can get a copy of the vaccine card. And what makes sense for each workplace is an individual decision, but you should think about a lot of things, the level of trust that you have in your employees, but also how many documents do you want to keep? What do you want to have to retain long-term? Osha, as example, has a 30-year post-employment requirement for medical records. Does a vaccine card, if you have a copy, does that count as a medical record that you need to keep for 30 plus years? So these are some of the considerations that you should be thinking through. In terms of the substance of what you want to look for, you need at a minimum the person's name, you need their vaccine type, and you need their vaccine date. And that's important for a couple of reasons. You know, we're talking about boosters a lot. So being able to track this, not just on a one-time basis, but on an ongoing basis here forward is really, really important. And adding that will save you from having to go through the process again. And the vaccine type may be important too. We know that the Pfizer vaccine was fully approved last week. You know, I haven't seen this question, but can you only mandate the Pfizer vaccine because that's the only one with the full approval? Probably not, because courts upheld it even with upheld the vaccine mandate even before any of the full approvals were authorized. But I think having the vaccine type is important to make sure it's one of the at least either the fully approved Pfizer or an EUA approved in the United States vaccine. You also need to be thinking about what policies that you might need to have in place at your workplace. We talked about document retention briefly, but that's something you definitely need to be looking at. But also a procedure if you're just having someone look at the vaccine card. What are they looking for? What are they tracking? And make sure that you have people trained and ready to do those things in your workforce. So really thinking through not just, you know, I want to mandate the vaccine or I want to encourage the vaccine, but logistically, how do I do that in a deliberate fashion to protect the information and get the information that you need at the outset? So next slide, please.
Okay, so we've talked about, can you mandate the vaccine? The answer is yes. So the next question is, okay, should you mandate the vaccine? And there's different schools of thought here, but purely from a legal perspective, the answer is yes. As Brittany has talked about, Osha has said, Osha encourages vaccination because it's the best way to keep a safe workplace. So if you want to comply with OSHA guidance, that's probably the best thing to do to maintain safe workplace, keep yourself out of potential hot waters with OSHA. But there's also practical real world considerations when deciding whether or not to mandate the vaccine. A lot of those, which people I think had been alluded to again earlier in the presentation, is employee morale and worker shortages. These are problems we're hearing repeatedly from our clients. People are tired. We're just tired of the pandemic. We're all worn out. We don't want to deal with it anymore. Unfortunately, that doesn't make it go away. It's still here and it's getting worse again, unfortunately. But it is weighing on employees and really impacting morale. So that's one reason maybe you don't want to mandate it. Or, you know, you have, I know, particularly in the service industry, people are struggling with worker shortages and not having enough people to do their job. And restaurants are having to put up post signs that say, shortage staff today, closed, we'll see you tomorrow. So those are all good reasons maybe you don't want to mandate the vaccine. The compromise that we are seeing more and more from our clients are these kind of soft vaccine mandates. And under those, they would use the language to say that it's a mandatory vaccine policy, everyone must get it, except for those who have an ADA disability, qualified disability, a sincerely held religious belief. We've talked about that. The third category that comes into play under these soft mandates is, or if you have a personal objection. So the reality of this is it's not really mandatory because it is making exceptions for anyone who has personal preference. The difference here, though, between just incentivizing vaccination and mandating it, even with the exemption for people who have a personal objection, is lots of times what we're seeing here is then there are essentially penalties if you don't get vaccinated. So like I mentioned before, the common accommodations for anyone who has a disability or a religious reason why they can't get vaccinated is mask wearing and weekly testing. So what clients are doing is they're applying those same accommodations to anyone who has a personal preference and saying, okay, fine, if you don't want to get vaccinated because of your personal objection, that's fine, but you're going to continue wearing masks even when even when vaccinated people don't have to, and you're going to get tested weekly or bi-weekly, which that alone is just kind of a pain, and I don't think people really want to do it. So that might be enough to encourage those people to go get vaccinated. The other questions or issues that come up under that kind of soft vaccine mandate is who's paying the cost, specifically who's paying for the costs of the tests for people who can't be or don't want to be vaccinated, and do you have to pay for the time spent getting tested? This is a gray area, to say the least. and it's an area that we fully anticipate will be challenged in court. That said, kind of the best guidance that we think applies under the current prevailing law is if it's a true accommodation, meaning it's an ADA, disability, or a religious belief, then generally the employer should cover that cost. They should cover the cost of the test, and they should pay for, if it's a non-exempt employee, should pay for any time that's spent outside of working hours to get tested. If it's merely someone's personal objection that's preventing them from getting vaccinated, and so the employer gives them an exemption under the policy, then you might shift that cost to them. And that distinguishes between people who are actually protected under the law and those who are not, but just don't want to be vaccinated. And it's, again, a way for employers to gently mandate vaccines without actually mandating it, and without having to terminate staff where you might otherwise be short-staffed to begin with. Next slide, please. So this kind of moves away from the mandatory vaccination policy into just what are some other options. If you don't want to mandate it, but you want to encourage it, what are some ways to do this? And we're seeing clients do a number of different creative ideas here to encourage vaccination. And I think Joe kind of talked about this previously, but weekly drawings is something that we see. Our firm in particular, we do a weekly drawing for anyone who's been vaccinated, and you continue to get your name in the raffle every week, as long as you are keeping your vaccination status updated with the system. Some clients we've talked to who are doing weekly drawings are up in the ante, so it's kind of a rolling ball. They say if 50 people get vaccinated, it's going to be X amount of dollars. If 100 get vaccinated, it's going up, another 500. If we get to 90% vaccination status, we'll increase it again. So it's kind of a stair-stepped process. And the more people that get, that also kind of applies some peer pressure, like, hey, we could up this to $2,500 instead of $500 if you go get vaccinated. So that's one way to do it. Discounted rates on insurance premiums through wellness plans. That's something that we're seeing again. I think someone else mentioned that earlier in the presentation this morning. The health insurance surcharge, that's the Delta program that recently came out, that Delta Airlines, that I think a lot of people were kind of surprised by. It's the first policy of its kind, at least that we've seen. And it essentially applies a penalty in terms of increasing insurance rates for anyone who doesn't get the COVID vaccine. There's a lot of considerations, if that's something that you're looking at, a lot of legal considerations that you'll want to talk through with outside counsel to determine whether or not that's appropriate for you. The general kind of thinking is it's similar to the surcharge that can be applied to like smoking employees, because they increase the cost of insurance. So some companies or wellness plans will raise their rates a little bit. So the general thinking is that it's similar to that. But again, I think this is something that we're going to see get challenged in court and get a more definitive ruling on whether or not it's legally permissible, or eventually the EEOC will probably have some comments on it. Another common thing we see, another common incentive is, just additional PTO time to, you don't have to use your PTO to get vaccinated or to recover from the vaccine. If you have side effects, you can go ahead and they'll give you extra time. And for anyone who doesn't get vaccinated, if you get sick, you have to use your PTO time. You don't get that additional time. And I think we're on to our last slide.
Yep, and we are about to wrap, but one thing that we wanted to hit on, we've gotten a lot of questions about vaccine passports and prohibitions. Currently, neither Kansas nor Missouri prohibits private employers from issuing vaccine mandates, but other states have a variety of different types of limits, some of which may be applicable to private employers, either explicitly, like Montana, or in other ways by regulating consumers, like Texas, or some states have made vaccine mandates prohibited from any entity that seeks state funding. So these are just things that the overlay of federal, state, and local requirements. Just a friendly reminder to make sure that you're looking at each level when evaluating what you should do. And then to Molly's point, that there's litigation, make sure that you're keeping up to date on it. It could very easily be a full-time job, but we're pushing out alerts all the time. I know a lot of entities are, so really try to keep apprised of what the litigation is showing. And thank you for having us. We will stay for the Q&A session, but Carolyn, back to you.
So thank you so much, Molly and Brittany. That was awesome information and a very helpful baseline of information for all of us who are thinking through these issues. Now, both of these ladies will be sticking around to answer your questions. I know there's some questions in the chat already for you ladies, so be prepared. So when we get to our Q&A section, we will have them to answer those questions as well. So now it's my pleasure to welcome our panelists. And these are chamber members representing different areas of our business community who have tackled this vaccine issue and are going to share their experiences with us. So in alphabetical order, please welcome Deidre Anderson. She's the Executive Director of United Inner City Services and St. Mark Child Development Center. And UICS has 3 locations, 2 of which of these serve the Kansas City's 3rd district, which has the highest COVID rates in the city. Deidre is the 2019 recipient of the Evelyn Wasserstrom Award for her ongoing efforts to ensure that students in Kansas City have equitable access to high quality pre-K education. And that's very important to our chamber also. Next up is Diane Gallagher. She's the Vice President and Head of Employee Experience at American Century Investment. She serves on the Human Resources Leadership Team and American Century's Diversity, Equity, and Inclusion Committee. Our third panelist is Stephen Gound, and he is the Chairman Emeritus of LabConco Corporation. Stephen has been with LabConco, which specializes in laboratory equipment, for 40 years. And he's also served on several boards in KC, including the Children's Place, Gillis Center, MRI Global, and Commerce Bank of Kansas City. And finally, we have Charlie Shields, who is the President and CEO of Truman Medical Center's University Health, and the former president of the Missouri Senate. Under Charlie's leadership, Truman became the first healthcare system in the region to require staff to be fully vaccinated. And I know we're all interested in hearing from him. So panelists, we're looking forward to hearing from you. And first, I'll start with Deidre and ask you to describe your business and organization and the work that you do.
Good morning. United Inner City Services, primary services, quality early childhood programming. We have 3 centers that serve more than 300 children when we're not in a pandemic and we're at full enrollment. It's been a challenge to maintain enrollment due to family preferences to keep their children at home and the challenges associated with staffing that were brought up by the legal experts that we definitely are feeling the heat of. I think I'm to wait for a moment on our vaccination policy, correct?
Yes, I'll come back to you on that. So how about you, Diane?
Hi, I'm Diane Gallagher from American Century Investments, and we have been managing money since 1958 for individuals and institutions, corporations, foundations. Company started right here where we still are in the Country Club Plaza, where it is storming still here. If anyone's looking around what's happening on the plaza, we have more than 1,400 employees around the world, the majority of whom though sit here in the metro. So we are happy to be a part of this discussion this morning about our community.
Great, thank you so much. And how about you, Stephen?
Morning. LabConco Corporation is a local manufacturer of laboratory and scientific equipment. We've been in business for 96 years, privately owned. All of our activity has been here in Kansas City in terms of our location. We make products that protect people, are used in research and development, drug discovery and development, as well as educational activities. We've got about 300 employees, 220 of them are here in Kansas City. We have a plant in Fort Scott, Kansas with about 50, and then we have 30 employees who are scattered throughout the US. So we're an essential manufacturer, so we have been working consistently and continuously since the pandemic began to manufacture products that can help with the fight. And we can talk about that as the discussion goes along.
Thank you for that. We appreciate it very much on behalf of all of us. So thank you. Charlie, how about you?
Hey, thanks, Carolyn. Good to be with you today. So I'm the president and CEO of Truman Medical Centers University Health. We are a 2-hospital system. We also operate a 188-bed long-term care facility. We're an academic medical center. We're the teaching hospital for the UMKC Health Sciences schools. Then we're also fill the role of a safety net hospital. So we provide care for those that, for whatever reason, are either without insurance, or we also always note we provide care for those people with the absolute best insurance. And we have about 4,500 employees. So in the hospital world, we're kind of a medium-sized provider, but we think we play a very significant role in the metro.
Absolutely. And we thank you for all of your great work as well. So Deidre, you're taking care of kids all day long. That obviously begs for an important vaccination policy. So what have you decided to do?
We have a very strongly encouraged vaccination policy that also provides a $250 bonus to staff that opt to become fully vaccinated. And if you choose not to be vaccinated, you are to have weekly COVID testing. And the only exemption we currently have is for those that have medical documentation indicating they're not able to be vaccinated.
Interesting. So Diane, is your workforce in the office primarily? And then what is your vaccination policy as well?
Today, our offices are open on a voluntary basis. So I am here. The offices are only open to fully vaccinated employees. Our offices will reopen on November 1st, but our intention is that the entire workforce be fully vaccinated against COVID-19 to physically come into our facilities. And that was really based on a sense of community and health and safety. We were able to function remotely during all this time because of a strong culture. And we just feel it's really important to get that collaboration, that sense of community, and certainly a premium on the health and safety of our colleagues.
Interesting. So Steve, you've been operational the whole time, and how have you dealt with the vaccination policies?
We are encouraging vaccination. We have not required vaccination. As you mentioned, Carolyn, we have been here with our production workforce, both here in Kansas City and in Fort Scott, and all the production support people have been here throughout the pandemic. As well, our executive committee has been here in the office, and we have added people on an A/B schedule as time has gone on. We have everybody here now, so that's our status at this point.
Interesting. Thank you. Charlie, how about you? We know that you're mandated vaccines at Truman.
Yes, we are. We actually made the decision back in July to do a vaccine mandate. So we've said that employees need to be fully vaccinated by September 20th. And so obviously we have a little bit of time left, but not much. It's coming up on that date. But this kind of follows our policy. You know, we made a decision early on in this pandemic that we had to take on a leadership role, whether it was first do a lot of testing, the first in the metro to give the vaccine, that doing a mandate for our employees is consistent with that leadership role. And that's the place we think we need to be, and that's where we're going.
So Charlie, while we have you, can you talk about, I know you said you wanted to make sure that you were leading in this. So what was that process like on this particular issue on mandating? And I know you have, concerns about staff shortages and that sort of thing. So how did all that play into your decision?
Yeah, obviously, we've followed other hospital systems across the country, particularly the Houston Methodist case, which was taken to court, and they prevailed in that case, and also some of our peers throughout the state. We decided that, as an organization, this was really important to us in terms of, you talk about staff shortage. Well, one of the reasons you have staff shortage is people out with COVID, to maintain our staffing levels, to make sure that our patients remain safe, that we could assure patients of safety while they're in the hospital. And then also, we think in terms of encouraging other healthcare organizations to do the same thing. That is one of the reasons we decided to go first in the metro. And it was a decision that was made with our entire leadership team. It wasn't just me unilaterally making that decision. We had great consensus on it. I can tell you, everybody thought it was the right thing to do, and we've received a lot of positive feedback within our own staff, but also within the community for making that decision.
Mm-hmm. That's great. Steve, how about you? How did you all, what was the process that you went through to make your decisions?
We had a small task force, which were the senior leaders in the organization. We have owner managers who are here, so it was really the ownership and the daily management who were involved in this. We spent a lot of time on it, as I'm sure each and every company in this call has done. For us, I think the biggest impact for us is our business spiked because of COVID. Our largest selling product is used in COVID testing, as well as drug discovery and drug development. And so all of a sudden we were faced with a situation where we had a huge influx of orders. So we were working lots of overtime. What we needed to do in a manufacturing facility is we worked to spread out our manufacturing process so that people could, for the most part, do social distancing as they accomplished their work activities. Early on, certain of our products, the non-COVID related products, really declined in our sales volume. So we were able to move people into the COVID related products to be able to satisfy the customer requirements. But it's been transformative to our business in terms of just the production requirements that we've had during these last 18 months. And that continues today, although the other parts of our business have rebounded significantly starting approximately a year ago. So it's become even more critical for us to be able to socially distance, to be able to have mask mandates and that sort of thing throughout our facilities.
We're glad to hear your business is ramping back up again. That's great to hear. So Diane, how about you? Talk about the process that you all went through, what that was like, how long it took, et cetera.
So the process really started, like so many organizations have already shared, and certainly Charlie shared, very early on in the pandemic. So our pandemic response team, which was made up of our business continuity group, HR, operations, facilities, and security, that continued through the course of the pandemic and how we were responding, how we were continuing to operate remotely primarily, but also having testing for our essential workers who were here and ensuring the safety standards here. Certainly then went up to our executive team. The conversation specifically about the vaccination requirement to be in the office absolutely accelerated once the vaccinations became more readily available in the spring. Ultimately, the decision was made to require, and that was communicated to employees on August 3rd, that our decision would be that employees had to be vaccinated to physically be in our facilities.
Wow, interesting. Thank you. All right, Deidre, can you tell us about your process, please?
Well, it just took one 3-year-old that tested positive. I think
there you
for
go.
Us, we lead by our mission, and our mission is to serve children and to steward their health and their safety. And we have been vigilant throughout with a committee of people and a really strong and thoughtful board, but also a ton of advisors from the outside. Early childhood, like hospitals, is an extremely regulated industry. There is no coordinated effort to tell us what we should and we shouldn't do. So we consistently have followed the CDC and the American Academy of Pediatrics advice. And so, well, not advice, I should say guidance. And when the child tested positive, also having double ear infection and pneumonia, I guess it was just a courageous leap of faith. And we also had a private donor that was willing to make a contribution. We have just under 100 employees, and they donated to allow us to provide the bonus. We are not like the other, the majority of our staff are not making a ton of money. They're doing really admirable work and essential work, other than on the very front end of the pandemic. When we were putting our pandemic plan together, we've been operating continually. And I don't regret the decision we've made. I will say it is the biggest challenge, I would say, thus far that we're experiencing. I never want anyone in our organization to feel like they're being marginalized or isolated or singled out. And for those that have chosen thus far, so our full policy goes into effect next week. And gratefully, Truman Medical Center has agreed to help us with the testing, but I still have a barrier because one of our locations is in the Northland and Truman doesn't have a location in the Northland. And so, in our hours of operation don't jive super well with testing. And so I just think it's one of those things where knowing your why behind whatever policy you choose is important. And for us, it's kids.
So Deidre, you have these amazing employees and who love the children that they work with, no doubt. What has been their reception for your policy?
You know, it's been mixed. I have a lot of staff that are frustrated with their peers that don't choose to get vaccinated. I have people that are frustrated with me because I'm the bearer of the news. And also a lot of misunderstanding around why we do not continue to pay emergency paid sick leave, and trying to explain that on the front end of the pandemic, there was no vaccination. So that was the government's accommodation. So now that we have a vaccination, we don't have EPSL. We don't pay 10 days of leave unless you have been fully vaccinated and then test positive. And so there's a lot of misunderstanding and then a lot of misinformation. So before we ever rolled our policy out, we had a African-American pediatrician. The majority of our staff are of color. And so we had a representative who they felt like they maybe could trust a bit more, that could answer their questions and share the information. So just getting caught in the crosshairs of all the politics surrounding it. And for me, I just have to try to encourage my staff to just maintain this steady line of why we're doing it and the choices we all have that we can make in the situation, versus I'm not trying to sway you. I'm not trying to tell you what to do. But also the angst of the rest of the leadership team, because staffing is so difficult. And I will say that for everyone we've lost, and we haven't lost anybody because of the vaccination policy, it's been a variety of other things. But even since we rolled it out, we have doubled the number of people that have gotten vaccinated. So it is definitely having a positive impact, and we'll continue to work through the challenges, be sensitive to those things. But in the end, since we rolled the policy out, we've had an additional 2 children that have tested positive. Gratefully, they've been asymptomatic, but it's just a whole different game when you talk about little, I mean, little children that are getting the COVID.
Yeah, that is pretty scary. So thank you so much for that. Charlie, what has been the reception from your employees?
Yeah, I think overall it's been extremely good. I mean, I think it's very positive. I mean, most people realize as an academic medical center, I mean, we base our decisions on science, and they believe that. So, you know, I was up in the ICU last Friday and visiting with those nurses, and they simply are very supportive. They can't understand why anybody wouldn't get vaccinated. Of course, they're on the front line. They see it every day. They're dealing with, you know, patients on respirators and patients that are passing. There are some that I think we will lose as an organization that simply choose not to do it for various reasons. You know, we have 4,500 employees. I think it would be kind of naive to believe that some will not leave the organization. I think they will. But overall, I think our employees appreciate that. You know, there's a reason people go into healthcare, and they go into healthcare because they think they you know, have a responsibility, an ethical responsibility to serve others, and they believe that this policy is consistent with that responsibility.
That's great. Thank you. Diane, how about you? What kind of reception have you gotten from your employees?
Yeah, generally it's been positive. As of the end of last week, we're at 88% of our employees were fully vaccinated, and at our core, our company was founded by James Stowers in 1958, who he and his wife went on to endow the Stowers Institute for Medical Research, which is part of our core. So to Charlie's point, I think that, the majority of our employees really embrace that sense of purpose here. So generally the response has been very positive.
Thank you. Steve, how about you?
Generally, we've had very positive feedback. I think some of the things that we've done have been frequent communication to our workforce about what our policies are, how they're changing, that we're complying with CDC guidelines and the guidelines of the state. And we've done that pretty consistently. We also, just given what people are doing, we try to emphasize the gratitude we have for the people working, as well as the mission that they're on that provides the products that are used in COVID testing. So we're really trying to help with with the fight against COVID. A couple of other things that we have done is lots of lunches that we brought in for our workforce while they were here. In May, we implemented a hero bonus where we paid a spot bonus of $500 net to each employee who had been here during, working in the facility for, the last, at that point, 3 months, and have given them an additional day of paid time off. They've been working lots of overtime, so it's been pretty grueling for us. So we've done those kinds of things, continuing to encourage but not mandate vaccinations. We've had vaccination clinics here. We've had 4 in Kansas City, and we've had 4 in our Fort Scott facility to try to open up to our associates as well as their family members. We've even vaccinated some neighbors here in the area where we are to just try to increase the overall vaccination rates. I think all of those things, but primarily the communication, have really added to the compliance and the understanding of what our policies are and why they are that way.
That sounds like you're doing a great job and thought of a lot of things to make it happen successfully. So congratulations to you on that. Charlie, do you think other healthcare facilities will be following in your footsteps? And do you think that they should be mandating vaccinations?
Well, yes, I think others will. I think particularly with the full FDA approval of the Pfizer and Moderna's going to follow shortly. I think most hospitals will assume the same position on this as they do on their yearly flu and influenza vaccines that they require. So I do think that's going to happen. But one thing I think the reasons hospitals are probably the first to do this is that we're a little dissimilar of other industries that, well, maybe not so much Deidre, but people entrust us with the health and their lives. And I think we have a responsibility as an industry to protect that trust and respond to that trust. And I think that's why hospitals are doing this. As I said, if you look across the state, MU Healthcare has done this, BJC out of St. Louis, Mercy, SSM, Cox in Springfield. So very quickly, you're seeing other hospitals come online. Then we just saw yesterday that St. Luke's made their requirement. They joined us and Liberty Hospital, and I think you'll see other hospitals in the metro come on as well.
So thank you. Diane, when you think about attracting talent to American Century, is the vaccine policy something that's impacting your ability to recruit or retain employees?
Our vaccination approach is very consistent in our industry with both our peer organizations as well as our clients. So we are finding that we are right in line with what people in our industry would expect.
That's great. And so, Steve, I have a question for you. You have these locations in totally different places. And so how have your policies been impacted by these different locations that you've had and the different cultures that you're dealing with at each location? How have you managed through that?
Great question. As I mentioned, we have most of our associates here in Kansas City, and we've been successful in not having any spread of COVID, particularly in our manufacturing facility, which is where we were most significantly concerned about as we've gone through all of this. There's good compliance among our administrative workforce, sales and marketing, et cetera, who are here. There's a little more vaccine hesitancy among our production workforce in Kansas City. What we've done is we have recently announced an incentive to get vaccinated. So we'll pay $100 to anybody who gets vaccinated, or they can get a half day's PTO, or they can contribute $100 to, or will contribute on their behalf $100 to as a donation, and we'll match that donation. So we'll double the impact of their donation. I think that has helped us move the needle some. And the other thing it does is it gives us the ability to determine who has been vaccinated, as our legal counsel has discussed, in terms of getting that information. In Fort Scott, there's more vaccine hesitancy in a rural community. Fort Scott's about 90 miles south of Kansas City. It's been more of a challenge there to increase the vaccination rates. In the office staff, I think we've done fairly well. It's a little more difficult on the production workforce. It's a smaller workforce. It's a plant where we can do more social distancing. It's generally a younger workforce, and so again, we're encouraging and we're trying to make progress in that area. But really, we've got three different groups to deal with. The incentive is applicable to all associates, and it also includes all people who have been previously vaccinated that are LabConco associates. So we made the benefit available to everyone at the time we announced it.
And what is your percentage currently?
It's a different percentage in each one. We would be over 80% in the Kansas City office. We'd be about the city's average in our Kansas City production facility, and we'd be a little less than that in Fort Scott. So I don't have the exact percentages at this point. We're hoping that they're going to continue to rise.
And so the FDA approval in particular for the Pfizer vaccine, is that something that you all have been promoting with your organizations as well, with your folks? And have you seen a jump as a result of that? Steve, I'll start with you.
Sure, I think it'll really help. I think part of the vaccine hesitancy has been awaiting approval. So we have seen more. We've got an upcoming vaccine clinic here this week, and we've seen more people sign up for it recently that had been hesitant before. So hopefully that too will help move the needle on the numbers.
Charlie, after the Pfizer vaccine was approved, did you receive a increased amount of inquiries about vaccination opportunities from employers?
To get myself off mute. Yes, to a certain extent. I mean, I think there are people that were waiting for full FDA approval. There was a lot of confusion around the emergency use authorization. Some people mischaracterized that as this was an experimental vaccine, which never was the case. But I think that sort of alleviated some fears around it. But I would also be quick to say, at the height of our vaccinations, we were doing 2,500 a day. We're now doing 200 to 300 a day. So it's not like there's this big bolus of people waiting for full FDA approval and all of a sudden are rushing to get vaccinated. I mean, I think it has an impact. I just don't know how big that impact is.
We wish it were 2,500 a day back again, right?
Right.
So Deidre, was that something that you found your team was important for your associates or for the parents of these children as well, who were hoping that that would increase the vaccination rates there?
I can't say that the FDA approval did. I will say that there was an immediate positive response after there was an hour-long opportunity for them to get questions answered. To Charlie's point about the emergency use of the vaccination, that getting cleared up and them getting an understanding that this is not new, it's related to SARS that we've been working toward vaccinations on since 2012. That clearing up myths and answering questions, I think helped more than anything. The tragic thing I think that's going to happen for our employees that's going to move the needle. We're in week 3 of school. I have one entire early childhood center that's quarantined and 2 classrooms in the other 2 centers that are quarantined. And there's in both of the classrooms, the teacher was not vaccinated yet. And at the facility in the Northland that's currently quarantined, it has the lowest number of staff that are vaccinated. When the reality of, if we do not have remote work for you to do, you will have to use your personal time because you're not vaccinated. When that hits, I think it's a different conversation for employees in terms of what they're willing to do. I hate when I get the reaction that you're forcing me to get vaccinated. My reaction is, I'm sure it feels like that, and I apologize if it feels like that. But I'm simply telling you, this is why we're doing it. This is what we're doing, and you do still have a choice. And just remaining consistent and checking my emotions at the end of the day, because it's, it's just like, what is it going to take? And, I don't mind telling people in early November, I had COVID, very mild case. I mean, the minute that vaccine came out, I said, I would never want to experience what I've seen in the media and through loved ones and what Charlie's dealing with at the hospital every day. So I was willing, but I'm not everybody else. And so I don't get to make a personal choice for other people. But the challenging thing for environments like mine and for the schools is that the extent of the contact tracing is extremely extensive, and it dang near takes you out of operations. And that's what's tragic for children, because they're not continuing to learn. And it's also tragic for families because they need us and their children's schools in order for them to go to work. And so it's not a political thing. It is, the more people in an environment, the more likely you are to be exposed, hence the need for the vaccine.
Very passionate report from you. So thank you for that very much. We appreciate it. And we appreciate everything that you're doing to help keep those kids safe. And that's fantastic. Did any of you experience anything unexpected? Like, whoa, I never would have thought of this, that others should be thinking about or could be thinking about that would help them?
I don't mind starting.
Go ahead.
I didn't expect how complicated it was for people to get tested. I was super grateful that Charlie and I had a conversation. I got connected through their employer offered testing program. And I'm going to say for all employers, it is smooth. Like, his staff run a very well-oiled machine, and it's going to be super easy for us once we start that next week. But I was not expecting how complicated that was going to be, because I guess I'm thinking back to the beginning of the pandemic and the readily available and accessible. It's a different time that we're in now. And so if you don't show that you're symptomatic, you're subject to either lying on the questionnaire or having to pay for the testing. And so that is something that, if you're considering a policy that requires testing, be sure you're thinking that out. And I'm working through overcoming the barrier for the staff in the Northland facility to get them a location that's easily accessible to them, because the other 2 centers have one, but I'm just not there yet on the 3rd one.
So Charlie, if companies are looking for guidance on where to go to get testing, is there a good place to send them to find that information?
yeah, they can just call, they can call my office and I'll hook them up with the right people, and we can help employers. We do that with a number of different employers in the metro right now. We have programs to help get their employees tested. And as Deidre said, it's very easy. We have 2 locations, they're drive-through locations. It's pretty smooth.
Awesome, thank you. Any other unexpected considerations that we should think about?
I would just
Diane?
raise, oh yeah, I would just raise one thing, and it goes back to what Brittany and Molly were talking about in terms of records. And it's just a logistics question when it was around making sure our system could accept, setting up our system to accept an upload of the vaccination card into employee records. So it's really just some of that logistical information. How do we capture this? Where is it stored, et cetera, et cetera. So I think that's just, I think about that, 2 years ago, did anyone think that they would have to work with their IT teams to set up some sort of mechanism to do that? Probably not. So I think it's just more of paying attention to how those processes go, making other decisions around travel, what your travel policies are, what as everyone's talked about, that for our essential workers who've been here, the whole time, what is their experience like inside the facility? So I think we all have learned over this period of time, just setting up policies and procedures that we didn't anticipate, before that. Every good business resiliency plan was tested, and I think that was just a lot of it is logistics.
Great, thank you. Any other unexpected considerations?
From
Well,
my standpoint,
this is,
I'm sorry.
just
go
in general, what I would, sorry, Steve, I didn't mean to talk over you there. It goes past healthcare, but I think the thing that's been amazing to me through this whole deal is that the impact of social media and the spread of misinformation. It just astounds me that people who their entire life have trusted their physicians and their healthcare providers to help them make decisions, all of a sudden don't trust them and are willing to trust somebody they're seeing on social media. I have a hard time understanding it, but I can tell you the depth of feeling of those that don't want to get vaccinated is very, very deep.
Yes, that is interesting. That's a good thing to point out. So thank you very much, Charlie. Steve, how about you?
In our experience, I think the sheer magnitude of the time that we have devoted to all of this in terms of policies, helping people find a place to get tested, having the various quarantine policies, that sort of thing. It has been an enormous amount of time and effort, particularly from our HR folks and our managers. All of this at the same time that your business has spiked well beyond where you thought it would be has been a real challenge for our whole group.
So one of your pieces of advice is to start early on thinking through your policy and know that it's going to take some time to get through it all.
Sure, and I think the other one is communicate the policy, develop it, communicate it routinely with folks, apply it consistently as you go through it, and make sure you're that you've got the resources in place to be able to answer the questions, to help people get tested, to lead them through the process, and you can't do it without those things. But I do think that communication is a huge part of it.
Deidre, you were nodding your head earlier.
I just want to take care of kids. I don't like it. It's very exhausting. It is. And I think what Charlie said is really true about this whole notion of the misinformation that's out there and like who becomes an expert. It's pretty real. I guess I was naive. I guess I thought, okay, we'll just put this in policy in place and this is a decent bonus and they'll just respond. And there will be holdouts, and being prepared for that because and that's their right. And I doesn't mean I agree with it, but that's their right. And I think I'm at the place where I can accept that my workforce may diminish, but I will be able to operate because then I will have a core of people. I flat out told my staff, we're trying to get to herd immunity within our own staff and to be ensure that because it's not just 300 children and 100 staff. Somebody's dropping off and picking kids up every day, and it may not be the same adult. So that's the volume of the exposure is extremely extensive for us. And so, but I can't operate at all when people are not vaccinated and they're exposed. I don't get to control outside of work what they do. I wish I could, but I don't. The other significant challenge is masking. We require masks all the time. And because of competing with what they do or they don't do outside of work and what local jurisdictions are saying and whether or not other businesses are enforcing those mask mandates and requirements and, you know, all the controversy around masks. For us, the close proximity like that, masks are critically important. There's no way to keep 3-year-olds social distance. It just does not happen. And then putting masks on children 2 and up, that was the toughest thing for me, to watch kids have to put masks on. And, you know, they're not super compliant, but we're doing our best to get them to wear them.
Okay, before we get to the questions, any other advice that you would have? And then we'll get to the Q&A right away. If someone hasn't come up with a policy, besides talking to Molly and Brittany and others, all these great experienced people, any other advice that you all would have?
Obviously, it's always good to talk to your counsel, but talk to your peer employers, people in your same industry, and ask what their experiences are. Because I can tell you in the healthcare world, we're in the hospital world, we're happy to share.
Great, thank you very much. So we do have a question for Brittany or Molly, and I think you're still there. So you had a recommendation that employers not identify the people as vaccinated or unvaccinated, i.e. with stickers, et cetera. So is this recommendation rooted in the ADA's confidentiality requirements is the question for you.
It does relate to ADA in part because someone maybe isn't vaccinated because of a medical condition, and you don't necessarily want everyone in the company knowing that. That's private information. It's not information that should be shared beyond maybe those who need to know it. For example, a supervisor might need to know so that they can implement and be aware of the accommodation provided. But it's not information that you want to provide to just anyone in the company, which is why we want to keep that private. The other reason, just from a real world perspective, that you might not want to share this information is because masking and vaccination and your belief in whether COVID's real or how severe it is has become incredibly political, and it's a heated issue and not everyone sees eye to eye. So it could just create animosity or hard feelings in the workplace that are taking an already uncomfortable, challenging work environment and making it even worse. So even outside of the ADA, I would recommend that you would want to keep that information confidential just to promote as much peace and happiness in the workplace as you can.
That's it. That's a great advice. So thank you for that. Also, while I have you, are there websites that offer downloadable religious accommodation documentation for those who are looking for that?
I have seen, so we've got our task force and we are regularly in communication with each other. And one of our task force members just forwarded, I think it was like a 5 or maybe even 10-page document that was some sort of downloaded document that people are apparently passing around for religious beliefs. And I don't know if this is what the person asking the question is referring to, but it's a series of maybe 20 or more questions to pose to the employer about the vaccination. I would just say you stick with what your policy is. The policy is you get vaccinated unless you have a disability or sincerely held religious belief. And if they're providing you something that's clearly been downloaded from the internet, you have a right, I think, to drill down on that and question them. As long as you are ultimately providing an accommodation if you determine it's a sincerely held belief. That's what you need to do, but you have a right to question them on what they're telling you and how their religion impacts or prevents them from getting the vaccination.
Charlie, would you be willing to comment about in your organization what you've seen from the religious exemption standpoint?
Well, I mean, clearly we have some employees that have submitted forms for religious exemption. We review those. That's reviewed by our general counsel and our HR department, trying to make that determination that Molly and Brittany talked about, where that's sincerely held or something somebody picked up off the internet. I can tell you that does happen. It's out there. So we're working through that. Although I would say, in sheer numbers, the number of people that have put forward a religious exemption based on those beliefs, it's not overwhelming in the organization. We also have medical exemptions, and we also allow for exemptions for members of our workforce who are pregnant, although we require an attestation that they will become immunized within 30 days when they return to work.
Interesting. So for those, Charlie, while we have you, for those, for you who has a vaccination mandate, this is from Warren Erdman. So what are you experiencing with the employees who object and decide, just, I'm not going to do it. It's not a religious exemption. I'm just not going to get vaccinated. So how are you dealing with that? What happens to those employees? And maybe what kind of a percentage of those employees do you have?
Won't know fully until we get to that September 20th date. I think it'll be a small number of folks. Ultimately, they will exit the organization, but I think what's more important is other hospitals come along with similar policies. We're all going to end up, I think, in the same place where, COVID vaccination is the same as flu vaccination, is the same as influenza is, and some requirement for Hep B, depending on your exposure levels. So I think people that are going to exit us are ultimately make a decision to exit hospital-based healthcare employment as a result of that, because I think every hospital is going to be in the same place. I understand that. I respect people's decision about that. But I don't think there's going to be a hospital locally, or in fact, I'm not sure nationally, where they'll have the employment opportunity. I think it's a decision they're going to have to weigh whether they want to stay working in the health system based on hospital employment.
So also, what about those who have had COVID and they can bring forth lab results that show that they have the antibodies? How are you handling that?
Okay, so first thing I would say is I'm not a clinician, but our stance is that the science around the antibody testing and what those tests mean in terms of your level of immunity from COVID is not fully developed yet. And I can tell you that we have clearly seen in our hospital, we've seen people that have been infected a second time with COVID. So we don't allow that as being the same as vaccination at this point. Now, I'm not saying that at some point the science will get more developed and the antibody testing will be more developed and we may be able to figure that out, but I don't think we're quite there yet.
So in this instance, you're still requiring the vaccination.
Yes.
In addition.
Carolyn, I would also add that just from a legal perspective, and Brittany can correct me if I'm wrong, because she's actually our OSHA expert, but OSHA talks about this in terms of vaccination, not antibodies from prior infection. To have a safe workplace, vaccination is the best way to go. So I would think just from a legal perspective, that would be preferred over antibodies from prior infection.
Thank you.
I did, however, our policy, if you have tested positive, just the same way with the CDC, and you do not have to quarantine for 90 days, you have 90 days from that positive test to then get vaccinated. They're not subjected to the weekly testing in that time period. And so after that, then it reverts back to weekly testing after the 90-day period.
So Deidre, while we have you, are you doing anything with contractors or other clients who are coming into your space, and what are the requirements for them?
Really great question. There's not an absence of people that work with children. And so I don't get to require it of state regulators. Unfortunately, I have to let them in, and I don't get to ask them if they have if they're vaccinated. But we're an arts integrated preschool, and we work with a ton of local arts organizations, and they have so graciously, readily shared with us that their staff are vaccinated. So we have a couple of long-standing residents that will be working throughout the school year. And so we pretty much are not allowing any volunteers in or any additional people right now, unless they are something that is essential to the ongoing delivery of services, like children that are on IEPs, have early childhood special ed folks that come into the classrooms. Most of that, it is not like a mandate requirement, but I do think I need to follow up with my legal counsel about that, because I think our employees could challenge us. They've just volunteered the information thus far, but I think we could come to a juncture where someone could not volunteer the information, and that would kind of tip us off that they have not been vaccinated. But in general, it's like minimizing the number of people. Parents are really only allowed for like drop off pickup. Like if you need to meet with the teacher or somebody, you have to actually make an appointment so we can set it up with the proper protocols and things like that. We're really minimizing people who come in and out of the facilities.
Yeah, and just to interject there, Carolyn, Molly said on the last question that OSHA can dictate that as well. Another OSHA recommendation is to make sure that you have policies in place for any guests or visitors into your space, and then make sure that that's uniformly applied. And so if you have a mask mandate or a face covering mandate or a symptom screening, that's something that you can and should make everyone coming in that's a guest or visitor do in advance. So that's another recommendation from OSHA, is just to roll out a policy for any guest, visitor, contractor into your space and apply it uniformly.
So we can require attendees to be fully vaccinated, which is one of the questions. And as long as we're, again, uniformly applying that, we're good to go on that kind of an issue.
I don't know if Molly has anything she'd like to add on if you had a screening that said before you come in, you must be fully vaccinated. I'm not sure how that works from a reasonable accommodation perspective if it's visitors into your space, but certainly for other things like symptoms and face coverings and distancing, those are definitely things that you can do. And I'm not going to overstep and steal Molly's thunder on that one.
The reasonable accommodation applies to your employees. So a visitor wouldn't necessarily be covered under the ADA. That said, if they have some sort of medical condition, you could, if they say they, I don't know, can't wear a mask for some reason, then you might just say, okay, well, you can't come in and you have to conduct your business virtually, would be my recommendation.
Interesting. Lots of things to think about. Are there any other issues particularly related to disabilities that we should be thinking about based upon what you've heard today from some of these companies?
I assume that question's for me.
Yes. Sorry, Brittany. Or Molly, sorry.
No, that's fine. No, the biggest thing is just if someone comes to you and says they need a disability that because from, or, accommodation from the vaccine mandate, that you are engaging in the interactive process and working with them to figure out how you can accommodate that. The other, I guess, kind of key thing that I didn't touch on is there's no magic words for requesting an accommodation. So you should make sure you're training your managers, supervisors, HR personnel, whoever, on what it is to request an accommodation so they recognize it and understand it when it happens. The employee doesn't have to say, hey, I'm disabled under the ADA and I need a reasonable accommodation. It can be much more vague than that. So that's kind of a critical thing in making sure that you're complying with the ADA.
So Molly, do you see the question in the chat about PTO that is in there? And I can read that to you. So this company says they've allowed absenteeism flexibility during the pandemic, and they've not been penalizing employees for COVID-related absences. They see some employers are taking the approach that employees will now have to use PTO or take unpaid leave if not vaccinated. Are there legal concerns with taking the approach that will revert back to the typical absenteeism policy that issues essentially points for absences unless employees are vaccinated? And what about requiring that employees get a test for symptoms or exposure or face absenteeism consequences under typical policies?
Okay, there's a lot to unpack.
There's a lot there.
So I think as far as the PTO question, if I understand it, what the person's asking is, there's policies, employers are coming out with policies saying if you are vaccinated and you get infected or you need quarantine, we will give you additional PTO. You don't need to use your PTO bank. If you are unvaccinated, you're going to have to use your whatever PTO you've been allotted and or take unpaid leave. And is that permissible? As long as you are, again, I think as long as you're making an accommodation for someone who can't be vaccinated for a legally protected reason, either the disability under the ADA or a sincerely held religious belief, then I think that's fine. If you're making someone who can't be vaccinated because of some medical condition that prevents it, then I would not apply that rule to them. I would, again, provide some sort of accommodation that allows them to have the same benefit as their vaccinated people, vaccinated counterparts. And I'm sorry, there was a second part to that question that I'm now forgetting.
So what about requiring employees get a test for symptoms or exposure, or if they don't, they face absenteeism consequences under typical policies? I guess the question is, can you have them use their own time to get testing if they are one of those that are not getting vaccinated? If I've been exposed, for example, and I have to go get a test and I'm an unvaccinated person, can you require me to take my own time to do that under a normal policy? I think it's the question. I might be interpreting it incorrectly, but.
Yeah, and I'd generally provide the same response, make your accommodations. If it's an ADA or a religious belief outside of that, then I think that you can require them to get a test and they can either do it on their own time outside of work, or they can use PTO if it's done during work hours.
Yeah, and then just to highlight the complexity here, OSHA has also said, we want you to be really careful that we don't want sick people in the workplace, right? So we don't want to disincentivize too much that makes people not want to say, I have COVID, I might have COVID. I'm actually pretty sure it's allergies. I don't know how many times I've heard someone say, they said it's allergies. Go check anyway. It's probably not allergies, or it may not be allergies. But I mean, that's just really underscores the complexity of this and trying to figure out and really lay out a deliberate and intentional vetted policy that has gone through, some layers of scrutiny, whether it's with your legal team or your benefits team and some of your stakeholders, to say, what is the impact, if you have to use PTO to do this, is that going to go too far? Because what we're really trying to prevent against is people with COVID coming into the workplace. And so there is a way in every workplace to figure out how to thread that to the best of your ability, but it's complicated. It's logistically complicated because you have different agencies that have different drivers, and in some ways they feel conflicting. So really just making sure that Steve's talked about communicating your policy, and Diane talked about really thinking through your policy and all of the logistics, really going through that process if you haven't already, and thinking about how can I do this and how can I communicate it to my employees in a way that makes it implementable.
And one final question, can we ask someone in an interview if they are vaccinated? And I'll ask you, Brittany. Or Molly, either one.
I believe so, because it's not a medical inquiry. It's just, are you vaccinated? So yeah, I think that that's fine. And then Carolyn, one other thing, I think I saw a question in the chat that hasn't been answered yet about, can you disclose vaccination status if your vendors want to know, or customers or clients? If you're going into a customer's office and they want to know. The way I would handle that is I would just ask, when your employees report to you, I've been vaccinated, here's my COVID-19 card, I would just say, okay, great. Do you agree that we can share this information if a client or customer or someone requires it? And just get their agreement up front is be the best way to handle that.
Great, thank you. Thank you for finding that question. Appreciate it very much. All right, you guys have been amazing. Thank you so much. I'm going to turn it over to Joe Reardon to close us out.
Oh my gosh, thank you, Carolyn, and thank you to our panelists. What an unbelievably important and critical conversation. And I've learned so much today, and I think there's so much great information that everyone that's attending can take away from this. And so we thank you for sharing. We'll be posting this event on our YouTube channel, so you can go back and watch it or share it with anyone too. We think it's important to get this information out as widely as possible to all the businesses in Kansas City. You know, tomorrow's September, and the holidays aren't very far away. And the more that we can do to get folks vaccinated, every eligible Kansas Cityan, the better our chances are to have a holiday season that we can really enjoy with friends and family and gathering, and think about the plaza lights and those things that make Kansas City such a wonderful place. So we're doing this to make our workplaces safe. We're doing this to make everyone healthy. And we're doing this to get Kansas City to a better place. And thank you all very much for your commitment to doing that. And we look forward to continuing to help and serve you as business leaders in Kansas City, and doing all we can to make sure we proceed forward in a way that gets everybody to the right path and gets as many Kansas Cityans as possible vaccinated. So thank you all very much, and we hope you have a great rest of the day. Appreciate it.